Welcome to lesson 8.2. This is a longer question, so I'm going to be looking down at it. How do divisions about social programs and taxation, there it is again, in Canada and the US attempt to meet the needs of citizens? Two different countries, similar economies, if you remember back from chapter 6, but the way we go about social programs are going to be different. So stick around and let's learn something. Okay, lesson 8.2, how do decisions about social programs and taxation in Canada and the United States attempt to meet the needs of its citizens? We're going to start taking a deeper look with what social programs are. What are social programs? This is a picture of Tommy Douglas, and he is basically the reason why Canada has something called universal healthcare. Back in, when was it? I can't remember. I don't want to give the date because I don't want it to be wrong. I think it was sometime in, I'm going to say the 60s. If anybody Googles this and finds that I am wrong, please let me know. But he was part of a coalition government. And the way that he was going to help form the government at that time was that if the winning party at the time, which was a minority government, agreed to provide Canada with universal health care. So he is the father of universal health care in Canada. But that brings us back to our question, what are social programs? You remember from the last lesson, these are programs that are essentially services that are paid for by the government. And the goal is to make sure that the promotion of the well-being of citizens is happening within a country. And we want to reduce any economic inequalities that exist, so it kind of gives everybody in a country, Canada in our example, kind of a fair playing field. And the major social programs that Canada has, and there's a lot of them, but we've got healthcare, which we talked about in the first lesson, pensions for seniors, something called income assistance, and education. Yes, that's right. Education is a social program. It's provided by the government, is paid for by your tax dollars. I know you're going to come up and mention school fees. That's different. We're talking about education as a whole. And governments, they, depending on who's in power, they have different views when it comes to their social programs. Now, usually in Canada, it's safe to say that we will support the idea of using our taxes to provide services, key services to our citizens. But it's also fair to say that the government of the United States will support this idea too, but to a lesser extent. Anytime a government gets involved, we're moving to the left. Anytime that the government kind of loosens the reins where they are less involved, they will then move to the right. And I've got some political parties that are on here. Typically, this is how the political parties will fall traditionally. So in Canada, yes, we are a mixed economy, but typically the NDP will be seen as the party more to the left. Then next in line would be the Green Party, the Liberal Party, and then the Conservative parties will make up the party on the right-hand side. And in the United States, they are a market economy. They're not a true market economy, as you've learned in previous chapters, but the Democrats, they will be more to the left of the Republicans, who will then be more to the right. So let's take a look at healthcare, for example. In Canada, we have public health care. Our taxes pay for it, and it's decided for by the government. Our goal in Canada, when we take a look at Canada Health, is to heal people, and it's not to make a profit. In the United States, on the other hand, is not publicly administered, not paid for by taxes. Individuals have to pay health insurance, and they pay that company, that health insurance company, either on a monthly basis or an annual basis. Even if you don't get sick, you still have to pay that insurance. If you do become sick, then the insurance company will then pay for it. So let's take a look at how this is going to go. We've got the public health care way on the left, That'll be Canada. And the private healthcare way, which is going to be on the right, that is the United States. So both these individuals, they've hurt themselves, and both of them are going to be heading over to the emergency room. The girl on the left, she's going to a Canadian emergency room, and the boy on the right will be heading over to an American emergency room. And they are both going to receive their treatment by those doctors. On the left, Canada. On the right, the United States. Now, this is where the systems will differ. Later on, the dad of this girl is doing the taxes for Revenue Canada and finds out how much money this person is going to have to pay in taxes. And he's like, ooh, ouch, that's going to hurt. Okay. This person left the hospital without receiving a bill. On the right-hand side, you can still see that the family is still at the hospital, and now it's time to pay. You must pay for your services in an American hospital right away. This family received a bill, and they also owe a lot of money. In both systems, they feel the pressure of the finances that are associated with healthcare. On the left, the Canada system, this is the ouch through paying taxes. And on the right, the American system, this is the ouch when you get the hospital bill. So healthcare in Canada is paid for by taxes. Oh, we know this. I've told you this how many times already. If you don't know, then rewind or go back to another lesson because you weren't paying attention. When you get sick, if you get sick, everything's covered by the Canadian taxpayers through the Health Services of Canada. Okay. And healthcare actually, although it's paid for by the federal government, it's the responsibility of the provinces. They have the ultimate say in what they are going to fund and what they're not going to fund with the money given to them by the federal government. And we have the Canada Health Act. That's the law that exists in Canada that says that healthcare is going to be available to everyone in Canada. Now, that's healthcare. That is not dental or eye care. Sometimes these will be covered if you belong to a company that has benefit plans, or you can buy additional insurance as well. Now, there are some situations, emergency situations, where dental and eye will fall under the Canada Health Act, but typically your regular maintenance of your eyes and your teeth, that's going to have to be paid for out of pocket or through some sort of benefit plan. So our elective procedures I've got listed here, you have to pay for that out of pocket as well. So like a plastic surgery. Let's say you have a mole that is non-cancerous and you want to get that removed, well, you would have to pay out of pocket for that because that's not going to be covered by the Canada Health Act. Okay. Now, it's publicly administered, which means it's going to be comprehensive. It has to be universal. It has to be portable. It has to go from province to province, and it has to be accessible. These are the 5 main rules of the Canada Health Act. It's run by the government. It's not to be run for profit. It must provide care in hospitals. It must provide payment to physicians and surgeons. It must be universally accessible, so available to everybody, no matter where you live in Canada, and you must be able to receive care within a reasonable time and within a reasonable distance from where you live as well. Now, who defines what reasonable is? Well, that's up to the governments to define what is reasonable, and Canadians will have different definitions as to what reasonable means to them in their individual situations. Now, the United States, on the other hand, they've got private health care, which means as an individual, you would have to purchase health insurance, or you'd have to get a job that has health insurance supplied. Most Americans, though, they'll pay a monthly fee if they get sick, and the insurance company is going to cover those medical costs should an individual or a family member find themselves having to go to the doctor or to the emergency room. And oftentimes, unfortunately, this insurance is going to be very expensive. And last I checked, about 15% of the Americans, so about 50 million people in the United States, do not have health insurance. Okay. There is, however, some publicly administered health insurance for the elderly and for the disabled, or if you are extremely poor. Okay, you are going to be covered by something called Medicare or Medicaid. This is the Affordable Health Act. President Obama was introducing this, and his plan is to make healthcare more affordable to those low-income Americans who are struggling to pay for health insurance. Let's compare the two systems right now. We've got Canada and we've got the United States. In Canada, every citizen receives your basic health care because it's paid for by taxes. The provinces, each individual provinces, the 10 provinces, they will decide exactly what's covered, and the Canada Health Act is the legislation that governs all of this. In the United States, your health care is only covered if you make less than $15,000 a year. Then you'll get publicly administered health care. Other people, if you're making over that $15,000, you have to pay for health insurance. And this is governed by the legislation of the Social Security Act. Now, that's health care. There's other social services that exist, like pensions. In Canada, if you are over 65 and have lived in Canada for 10 years, you will get a pension plan. Paid for by taxes. Not so bad, hey? This is called the Old Age Security Act. If you're in the United States, no pension for you, my friends. You need to support yourself, or you need to rely on your family members. So when you get a job, you need to start saving. The government is not going to get involved when you get to the age of 65. Canada, on the other hand, you will start to receive a pension. And lots of countries do offer this old age pension. The United States, they do not. Another social program is income assistance. In Canada, your basic needs will be met if you cannot provide them for yourself. Food, clothing, and shelter. That will be provided for you. The individual provinces, of course, like healthcare, they decide how that's going to be done. But in the United States, nope, you are not going to get your basic needs provided by tax dollars. Now, there are organizations that will help those people meet basic needs, but it's not done by taxes. We're going to jump to focus only on Canadian taxes right now. And we know that our government collects taxes, right? They collect it to do a variety of different things, like paying for social programs. And taxes are collected at various levels of government. The federal government, the provincial government, and even your municipal governments will collect taxes. The federal government gives money to the provinces. This is called transfer payments, and this is done to pay for taxes, or not to pay for taxes, to pay for programs. And in any given year, we as Canadians, as a country, we might run a surplus, which means we have more money, or we are going to run a deficit, which means we spent more money than we had anticipated. You can see this is the last information, or the last source I could find. This is way back from 2016 and 17. This is how this is the percentage, and this is how the taxes get divided up here in Canada. And you can see some have to do with like national defense, and others are going to go to social programs. The government is going to try and use any surplus that it makes. Okay, they do run a debt, they do have a deficit, and so we're trying to pay that back. And last year we brought in, this is the last this would have been the last tax year, we brought in $293 billion, but as a country we spent $311 billion. If you do the math, we're running a deficit, and we are collecting our taxes and we're spending our money in three ways: income tax, sales tax, and something called property tax. Income tax is basically, this is how much, the more money you make, the more you're going to pay in taxes. And this is a progressive tax system. So as you make more money, your percentage of taxes is going to increase as well. And the government sets up various tax brackets to differentiate between the different wage earners and what percentage of taxes they are going to pay. So, for example, this is back from 2015. If you are making less than $44,701, your tax bracket is going to be 15%. So you're going to be paying 15% of that 44,000 is going to go to taxes. However, if you're making over $138,000, 29% of that is going to go towards taxes. Now, the Liberal government promised that they would change this system and they would change those tax rates. Okay, so they would still keep that base rate of 15%, but then they were going to add a new high income tax bracket. If you're making more than $200,000, then you are going to be paying 33% in taxes. So this is the graphic that's here, and then this is just the table that's there, so which kind of follows the other one. Now, there's some other information that needs to be shared with you. All of your income must be reported to the federal government on an annual basis. You don't pay your taxes, that's considered to be illegal. Okay. Now, your employer is probably going to set this up for you. So if your employer is taking off the correct amount of taxes throughout the year, you're not going to owe anything. Okay. You actually could wind up receiving money back, or if they're not taking off enough, you could owe money, right? And we do this once a year. In April is tax season in Canada, and people will often use investments, they will use businesses and other deductions to offset any kind of taxes that they might owe. And provinces also get involved here, and the provinces will also have their own income tax. So not only are you going to have to pay taxes to the federal government, but you're going to have to also pay taxes at the provincial level as well. Now, before the last election here in Alberta, this was the only province with a flat tax rate of 10%. This was for individuals and big businesses. And the NDP, they did make a promise that they would increase taxes for businesses, not for individuals, but they would increase for businesses. They would go from 10% to 12%. And they promised to introduce a more progressive tax system like that of the federal government. And now we have both systems in place here. So in Alberta, if you are making less than 125,000, that base rate of 10% stays the same. But as you make more money, you will be paying more taxes. So if you make more than 300,000, 15% of that is going to go towards taxes. Now, we also mentioned, and it's one of your vocab words, sales tax, the GST, the goods and services tax. This is 5% all across the board in Canada, and this accounts for about 15 to 17% of all of the taxes that's collected. So roughly, the last time they ran the numbers, this is about $35 billion. Some provinces also have a PST, a provincial sales tax. In addition to GST, you'd have to pay a provincial tax as well, and this is different by every single province. And Alberta is the only province currently that does not have a provincial sales tax. Everybody else has this harmonized tax, which is going to be shown here. These are your provincial taxes, and then you have your GST on that, but your harmonized tax is going to be your GST and your PST together so that you see it as one tax and not split into two. Now, that's what they do at the provincial level. But at the municipal level, taxes are also collected. This is your property tax. And every municipality charges taxes for property owners. This is based on the value of your home. This is based on the value of the property that you own. And of course, this individual cities will determine what your value is and what your taxes are going to be based on their current needs. And cities will use this to pay for garbage and recycling, to pay for parks, to pay for police services, fire and rescue, recreation, transit roads, whatever falls underneath the jurisdiction of the cities, they will charge you. Okay. Now, 35% of your property taxes will go to the provincial government to pay for education. So 35% of that. And as a property owner, you get to declare where you want that money to go. Do you want it to go to public schools or do you want it to go to the separate school board? So in Alberta, that's public and that'll be Catholic. Okay. That's taxes. Now, we know that Canada is running a deficit when it comes to taxes, and part of that reason is this cartoon here, tax evasion, my friends. I'm going to read through this cartoon. We have a homeowner on the right-hand side, and we've got a worker on the left. And the worker says, sure, I can cut down this tree for you. It's a big job, though. It's going to cost you $300. And I work cash, strictly cash. Okay? He continues to go and say, working for cash on weekends is good money. I could collect the GST as part of my fees, but I don't. I could report my fees as income, but I don't. I make sure the government doesn't know I've got the cash. It's tax-free, more money for me. This is an example of the underground economy at work, and the underground economy in Canada there's a lot of money happening in the underground economy, and this is all an example of tax evasion. When you misrepresent what you've made, this is tax evasion. Okay, when you're shopping, get a receipt. If you get a receipt, it's a paper trail, and this eliminates and reduces the amount of tax evasion that occurs, because this affects the tax base. And the tax base, we know, is our economic activity that a government is able to tax and then use in return for social programs. So people who earn money and don't report it, they're part of something called the underground economy, also known as the black market. So an example of this would be people working under the table to get paid in cash. Or let's say you're at a restaurant and you don't report the tips, the gratuities that you make when it comes time to filing your taxes. And this is a big problem in Canada. Billions, with a B, billions of dollars every year do not get reported because of tax evasion. And the argument would be then, well, if people declared that, then we would have better, more improved social programs. But then other people argue, but they will be getting charged more taxes. Okay, so it's kind of like a catch-22 there. But that is considered tax evasion, and it is illegal. I want to take a look here at how we divide up our taxes. This is right out of your textbook. This is what your taxes go towards, both at the federal level and at the provincial level. These are numbers all the way back from a very long time ago, 2007. The year actually doesn't matter. I'm just using this graphic to show you how different levels of government decide to spend their money. And you can see at the federal level, 32%, the biggest chunk of the pie, goes towards social services like affordable housing and pensions and the transfer program. And at the provincial level, you can see the highest piece of the pie is healthcare. So to sum things up, you have a job and you make income. That goes towards the individuals who then have to pay taxes to the government. And then the government takes those taxes and it divides it up for the various programs and services that it provides to everybody, like education, like income assistance and pensions and all that kind of stuff. Anything that's not reported here is considered tax evasion and is part of the underground economy. All right, head over to your notebooks and complete the questions for this part of the chapter.